Well, I'm now joined by the epidemiologist who organised the letter, Dr. Deepti Gurdasani. Thank you very much indeed for joining us this morning. So that's quite a strong statement, isn't it, that you're making? I mean, the question really is, if not now, then when?
I think that's a very easy question to answer. I mean, opening at the point of time where only 51%, so that's half of our population, is fully vaccinated and protected, means that there are many, many who are going to get infected in the coming weeks in the middle of a surging pandemic who could be protected in just a few weeks' time with vaccination. So we're sort of choosing a strategy of infecting people with the virus with long-term effects rather than vaccinating them, knowing fully that safe and effective vaccines are available and could be doled out in the coming weeks. And we can open up when many more people are vaccinated, which is now just a matter of a few more weeks or just 1 or 2 months, really. And we are not in severe restrictions at this point in time. So wearing masks, which is a minor inconvenience, investing in schools and ventilation, all of those things could be done while we vaccinate more people and open up in a safer way.
But, the government then would argue that it has to balance coronavirus with other forms of conditions which are also killing people, for example, cancer, for example. And it's not just about coronavirus, it's about the health of the nation. And this is something that Sajid Javid, the new health secretary, was saying. He said he's not just a coronavirus secretary, he's a health secretary. This is about the health of the nation.
Absolutely. And I agree with him, which is exactly why we have to get on top of coronavirus, because the reason people aren't getting health care for other conditions is not because of restrictions, it's because coronavirus is spreading. Just yesterday, we are hearing reports from NHS trusts who are having to cancel routine operations and care for those very cancer patients because their hospitals once again are filling up with coronavirus patients. I mean, if our hospitals fill up with coronavirus, how are we going to treat those people? So if we are concerned about routine healthcare, we should be concerned about controlling the pandemic, because that's the only way we can provide healthcare to people, prevent educational disruption, and protect not just public health and economy. Those are false dichotomies that have been laid down by government that have no scientific evidence behind them.
But death rates currently have reduced significantly thanks to the vaccines. So what about all of those cancer sufferers? Currently, there are more people dying from that than they are of COVID.
So tell me how do the current restrictions prevent those cancer sufferers from getting care? And how are they going to get care when thousands of them are being admitted to hospital every day?
So what was the point of the vaccines then? Because so far we are doing very well when it comes to the vaccines.
Yes.
A lot of us have been double jabbed. So what was the point then? A lot of people have gone and they've had their vaccinations, they've been double jabbed. And now you're saying we cannot open up, economy is struggling. There are lots of people who are struggling also with their mental health.
Because death isn't the only outcome. You've mentioned the other death from COVID isn't the only outcome. The other outcome is people who want routine care and have cancer not getting care because NHS trusts are full, which is actually happening now. The other outcome is long COVID. We know that 400,000 people already have had long COVID for more than a year. This is not the flu. Death is not the only outcome. And we expect 100,000 cases per day over the summer, which Sajid Javid himself has said. That means 10,000 new people with chronic illness coming out of that cohort every single day. That means hundreds of thousands more suffering with long COVID and having chronic disability, predominantly are young and children. So we are developing a sort of generation of chronic disability with what we are doing right now. Is that okay? And there is no dichotomy between cancer care and COVID care. You cannot provide cancer care if hospitals are full of COVID. That's very, very clear. And it's silly to ask, what was the point of vaccines? Of course, they reduce deaths, and that's very, very important. But that doesn't mean that we can let cases surge and leave hundreds of thousands of children and young people with disability, with a novel virus we don't even understand the long-term impacts of.
So you just touched on long COVID there, but then the people who have had coronavirus now, if they are going to have long COVID, will likely still have it regardless of the time that we open. So how then...
No, that's actually not true. If you vaccinate more people, many more are protected from infection because vaccines do provide a level of protection against infection as well. So you are providing a level of protection against long COVID. And as you vaccinate more people, transmission comes down in the population because you start seeing herd immunity effects. And that also reduces the chance that people will get infected and get long COVID. This is even more important for clinically vulnerable children, for example, who aren't even being offered the vaccination, are being pushed into schools with absolutely no mitigations in place, where they're very likely to get infected. What can they do to protect themselves? And they can get long COVID and serious illness. So I don't understand how you can possibly say that the situation will be the same in 4 weeks' time or 6 weeks' time when we are doling out vaccines every single day that could protect people rather than letting them get infected and get chronic illness.
I think one of the things that other people are also thinking about, you talk about long COVID, but also when it comes to mental health, that's also a long-lasting effect. A lot of people are being affected greatly by this because of the economic loss that they're suffering, because of the fact that they're having to be locked down for so long. We have to balance these things.
Absolutely. And why have those people suffered so much? It's because the government has always acted late, which has led to prolonged lockdowns. And very sadly, if we don't get on top of this, we might be heading towards yet another lockdown, because if cases do get high enough, the NHS is already struggling. We could get hospitals overwhelmed yet again, which would lead to another lockdown, which would be prolonged. And that's exactly what we need to avoid. Once again, you've fallen into the trap of the dichotomy the government has created between economy, mental health, lockdowns, and COVID. The reason we've had lockdowns is essentially because we never managed to control COVID in time and waited too long. If we had proper, good test, trace, isolate systems, focus on masking, ventilation early on, and active aggressively early on, we would have never needed lockdowns. Many countries in Southeast Asia control this without national lockdowns. And if government had followed scientific advice, we wouldn't have needed those prolonged lockdowns. So if you're angry about lockdowns, don't blame the scientists who've been advocating for measures that would have prevented them, but the government that constantly acted late and is doing that once again.
Dr. Deepti Gurdasani, thank you very much indeed for your time on Sky News this morning. Thank you.